Hi, in this video, I'm going to be talking about treatment-induced menopause in people with breast cancer. This actually does apply to treatment-induced menopause with other cancer as well. Before I go on, I'd love to invite you to subscribe to our channel. We put out about 3 videos a week, so there's always new content. Don't forget to go to yerbba.com for your personalized report. So what is treatment-induced menopause, and how does it differ from natural menopause? I'll start by defining natural menopause first. Over time, people with ovaries will have a point in their life where the ovaries will stop making estrogen and progesterone and stop producing eggs. This generally starts in our early 40s and will be complete between 45 and 55, at which point people will notice that their periods completely stop. One is not considered in menopause until one has gone a full year without a period. So because periods can become irregular, we generally wait a full 6 to 12 months before deciding that somebody truly is in menopause. Blood work can help confirm that, but it's important to know, especially for avoiding pregnancy, that the ovaries can continue to work quite late, even after a period with no periods. Treatment-induced menopause is when the treatment itself causes the ovaries to stop working. And that's quite sudden compared to natural menopause, which can take 10 years from start to finish and is much more gradual. Treatment-induced menopause can be much more rapid. So I'm going to talk about the types of treatments that can cause treatment-induced menopause, and then what that looks like, what that will feel like, and what the implications are of having it occur suddenly. So chemotherapy is the most well-known treatment that induces menopause. Chemotherapy affects rapidly dividing cells, and the ova in the ovaries, although not rapidly dividing, are also sensitive to chemotherapy. And because of the effects of chemotherapy, chemotherapy can stop the ovaries from working. Now, while this is gradual, doesn't usually happen with the first cycle alone, it can happen that quickly, especially if you're close to the age at which you are going to go through natural menopause. So if your periods are already irregular, you may notice that your periods stop altogether after your first chemotherapy. You are already approaching menopause. If you are young, it may take the full course of chemotherapy before you notice even menstrual irregularities. Your periods may continue like clockwork during all your treatments, or they may start to become irregular. If you are under 30, it is very likely that your periods will come back and that you will, number one, want to use methods to avoid pregnancy, and number two, maintain some hope that your periods will come back to normal. Although if you are considering fertility preservation, where you find a way to grow your family after breast cancer, you will want to do that, if possible, before you start chemotherapy. If you're interested in fertility preservation, talk to your medical team as soon as possible once you know you'll be getting chemotherapy, and you can check out our video about this as well. So chemotherapy can cause treatment-induced menopause. The other things that are known for causing menopause are injections we give to make the ovaries go asleep or dormant. So this isn't actual menopause, but your periods will stop. So there are people for whom we recommend medications called LH-RH analogs. We'll have the full spelling below for what that stands for. But these drugs basically put you into a medical menopause. They mimic menopause. And then when those injections stop, your periods are very likely to come back unless, of course, you were close to your natural menopause already. Sometimes we give these injections to help preserve your ovaries and the eggs. So when you go through chemotherapy, those eggs are kind of sleepy and they're not as vulnerable to chemotherapy. There aren't a lot of very large studies looking at this, but this may be one reason you're offered LH-RH analogs given by injection. The other reason you might be offered these medications, which again don't put you into menopause permanently but mimic menopause, is if your risk of recurrence is deemed to be fairly high and your periods are still working, your ovaries are still working at the end of chemotherapy. So for example, in somebody with estrogen receptor positive stage 3 breast cancer, whose periods never stop or come back right away after chemotherapy, we would offer ovarian suppression, which again is putting your ovaries asleep for a couple of years. The studies have looked at 2 or 3 years. And again, you're not in menopause, but you may feel like you're in menopause. And we're doing this in hopes of improving the chances that the cancer won't come back down the road in other parts of the body. The other thing that will induce menopause very quickly is removal of the ovaries. We would do that in somebody who is not able to get to the injections once a month, to keep the ovaries asleep, in people who were considering having their ovaries out already because they were close to natural menopause or they had an ovarian cyst that was causing trouble, or in somebody who wants to decrease their risk of ovarian cancer. This generally applies to people with a hereditary syndrome, an inherited susceptibility to breast and ovarian cancer, where decreasing the estrogen made by the ovaries, by removing them, can decrease the risk of cancer coming back and give you the added benefit of decreasing the risk of cancer, in particular in the fallopian tubes. Most ovarian cancer appears to start in the fallopian tubes, and in some people, removing just the fallopian tubes is an option. So if you are considering removal of the ovaries for prevention purposes, talk with your medical team about whether removing just the fallopian tubes is an option. So what does it feel like if you go through treatment-induced menopause? Well, it's very similar to natural menopause. So you may know about hot flashes and hot flushes and night sweats and other things related to changes in our vascular system. We call these vasomotor symptoms related to the motor function of our blood vessels. And this can lead us to flushing or sweating. It can wake us up in the middle of the night. And when it happens very abruptly, without it sort of creeping up on you, it can be quite jarring. So hot flashes and night sweats are probably the most common thing we think about. Some people get through it without any of the symptoms. Of course, another manifestation or effect of going through treatment-induced menopause can be emotional changes. You know, the end of our fertility, even if you were done having children, even if you never wanted to have kids, you know, this is the sort of an end of that chapter in your life, and that can be associated with some grief, anger, anxiety, you know, a whole host of emotions, all of which are normal and completely valid. Other side effects that people have include vaginal dryness, vaginal itching, and lack of lubrication. Some people get urinary tract infections because as estrogen is lowered in the body, the amount of estrogen getting to all the tissues in the body, especially the mucous membranes, is thinner. So those tissues become thinner. And people can get vaginal dryness and urinary tract infections. It's really all part of the same process. So that's something that can happen. That does take a little bit longer before being noticed. Often it doesn't hit as suddenly as the hot flashes and the night sweats. One of the most common effects of menopause are joint aches and pains. With time, as we get older, we tend to ache a little bit more than we did when we were younger. Menopause appears to be associated with more joint and muscle changes. Now, those are not necessarily permanent, and they can certainly be managed. The same things apply to endocrine treatment-associated joint symptoms, so you might want to check out that video as well. But one of the things to know is that movement can be incredibly helpful if you're feeling stiff and achy. And you may find that the stiffness and the pains get better throughout the day, or after you've been sitting a while, when you get up and start moving again, they tend to get better. So that's very common. You may notice your libido decreasing, and you may notice that once the fears of getting pregnant are gone, you may actually have an increase in libido. So it's not exactly clear which direction that goes. Many people who've gone through menopause have a very good libido and a very good intimate life. So please don't view this as deterministic. It's not necessarily the case. Then there are ways that you can make sure that your interest in intimacy stays high. The last thing I want to talk about is energy changes that can happen with menopause. Now, given everything else I've just told you, you can understand why people might be fatigued, but one of the things we hear very often is a decrease in energy. This is something you can combat. First of all, make sure you're not overdoing. Make sure that you're not right-sizing your energy level. And, if you've been a go, go, go person, maybe you get to enjoy your life a little bit more and not be chasing after things as much. But if you do notice that the fatigue is bothersome, first of all, talk with your medical team. We want to make sure there's nothing else explaining it, like thyroid changes or anemia, other things that can mimic menopause. So talk with your medical team and make sure there isn't something else going on. But exercise, getting outdoors every day, staying socially connected can give you more energy, as well as eating a balanced diet. I have covered a lot in this video. I hope it's been helpful. Don't forget to subscribe to our channel. Don't forget to go to Yerbba.com for your personalized report. And if you have a tip or trick for others in the Yerbba community, drop it below. Thanks for watching.